The honourable member for Caribou, Prince George.
Mr. Speaker, we're reaching epidemic levels of suicide in our country. The Prime Minister's own cabinet have acknowledged that suicide is on the rise and that we're facing a mental health crisis. Last week, the Prime Minister told Canadians who are feeling anxious or overwhelmed to call 211. Again, for the record, 211 is a directory. It's not even available in all regions of our country, and it's not a National Suicide Prevention Hotline. Is the Prime Minister comfortable with telling Canadians in crisis to please hold?
Honourable Prime Minister.
Mr. Speaker, we need to be there for Canadians when they need us the most. Canadians deserve access to mental health services regardless of where they live or when they need help. We're having discussions with partners on how we can help more people get the access to the help they need. We're open to having discussions about a consolidated hotline, and we'll work with members of this House on how we can continue to support Canadians through this pandemic and beyond. This pandemic has exposed many challenges in our society that we are going to continue to fix, not just for now, but for the years forward as well.
The honourable member for Caribou, Prince George.
Mr. Speaker, the U.S. has taken real action on suicide prevention by moving to a 988 National Suicide Prevention Hotline. The Prime Minister has said over and over again in this question period about protecting Canadians and saving lives. So this is a simple question. The time for him to step up is right now, and it's right here. Will the Prime Minister do the right thing, commit to working together in a bipartisan way, and bring 988 to Canada, yes or no?
Honourable Prime Minister.
Yes, Mr. Speaker, we are committed to working together to figure out how to best serve Canadians suffering from mental health challenges. In the very beginning, in 2015, we brought in record investments to the provinces on mental health. We've continued to work, including during this pandemic, on increasing the funding for Kids Help Phone by $7.5 million, by reaching out to the United Way to help them provide more services. But we're always happy to do more, and I look forward to working with the honourable member on this issue and making sure we're getting the very best help to Canadians that we possibly can.
The honourable Leader of the Opposition.
Mr. Speaker, there are rare occasions where I agree with the Prime Minister. We do need to be there. We all know that mental health issues have been aggravated by COVID-19. We all know that a single point of contact for those in need in their darkest hours will save lives. Isolation has already been a death sentence for too many. All MPs in the House know members of their family, their communities, and even their political families who've been struggling. So, we have an opportunity to work together for the mental health and well-being of all Canadians, Mr. Speaker. Will the Prime Minister join our effort to have a 988 hotline national by Christmas?
Honourable Prime Minister.
Mr. Speaker, we've made many investments in mental health. We've made many investments in programs that offer supports from Kids Help Phone to the United Way to others. We are happy to work with all members of this House on something, yes, indeed, we can all agree on. We need better supports, and we look forward to working with members to figure out exactly what that is and how we can get it delivered to Canadians.
The